I will be presenting the survey about the impact of COVID-19 on HIV people in two different settings, in Uganda and Malawi. Over the last 2 decades, significant progress has been made in fighting HIV. There are still big differences and discrepancies in the management cascade in the world, and achieving objectives is not the same everywhere. But in Uganda and Malawi, the two countries we have in our study, the UNAIDS objectives of 90% of screening, treatment coverage, and viral suppression have been achieved and should help to achieve this final objective to put an end to this pandemic. But for children and teenagers, we should make additional effort, and the mortality rate is still high in this region of the world, and maintaining care for these vulnerable people is key and should remain a priority for the health authorities. COVID-19 has meant a huge challenge for people with HIV/AIDS. And the measures which were made to mitigate its propagation and spreading have disrupted health and medical care and interrupted access to HIV care. People with HIV/AIDS are the victims of stigma and comorbidities, were often faced with difficulties of accessing healthcare even before the pandemic started. The aims and the objectives of this study was to describe the public health measures to control COVID-19 and the impact on people. We wanted to describe the changes in HIV service, to describe trends in the key programs, healthcare and clinical indicators in comparison with the previous period, and describe patients' perspective and on their perceptions on the impact of COVID-19 and the healthcare measures to control the epidemic on their lives and their ability to manage their health and HIV patient care in general. Even though our presentation will briefly covered the first two objectives, we will be detailing the result of the third objective by talking more specifically about the adolescents who are a key target in these MSF programs, because the changes in people living with HIV/AIDS for adults were more widely documented worldwide. So two different settings in terms of experience of the pandemic in Arua, Uganda, and Chiradzulu, Malawi, where MSF is present. Before the pandemic, in these two programs, MSF had for many years focused on adolescents and children who were HIV positive and adults with a high viral load, a suspicion of treatment failure, and people with an advanced stage of HIV. Several methods were used to meet these objectives, and for today's presentation, we've had face-to-face, individual interview, and focus groups of people living with HIV/AIDS or their carers, parents, when we were talking about children and adolescents. So I'll be briefly presenting the measures which were adopted during the first year of the pandemic, as well as the MSF response for HIV management. The lockdown was one of the strictest in the African continent, with a very high stringent measures, with a fear of violence, as reported by the MSF staff as well as the participant to the survey. MSF has adjusted its routine activity to respond to the requirement of the MOH, to the MSF policy and the epidemic situation, and resumed the most important activity for the management of people living with HIV, namely adolescents. And we've quickly implemented new strategies for the management and monitoring of these patients by reinforcing the community healthcare solutions and by having a hotline. In Malawi, the state of emergency was quickly announced with a lockdown, which was cancelled by the court. There was no restriction to internal mobility, But the inflation rate went very high very quickly. In spite of the measures suspending healthcare and reduction of the time spent in the centers as decided by the authorities, MSF negotiated with the MOH the teens clubs in a limited version and carried on with the monitoring of the viral load of people with a risk of treatment failure, and telemedicine was introduced in the second quarter of 2020. Now let's have a look at the trends in the key indicators. A reduction of the active cohort was observed in both areas, a significant decrease when initiating ARV treatment, and the number of clinical consultations due to the restrictions imposed by the government and because of the new monitoring strategies with delivery of differentiated treatment. A gradual resumption was observed but did not resume with the levels observed before the crisis because the size of the two active cohort has declined since the Covid-19 pandemic. Regarding the qualitative interviews, three main topics have emerged. Regarding the access to HIV services and care, in Uganda, the lockdown has limited people, the people from Congo at the border, while increasing violence of the armed forces, and people didn't have access to the hospital. And I'm reporting what Sharon said. She didn't go to the hospital because of the soldiers beating people in the streets. Sharon and her brother Felix were caught up with time. They were past curfew time, and soldiers started to beat them. The strategies which were introduced reinforcing the drug refill system were appreciated by our patients in Uganda and those who came from Congo who had to adjust themselves to have access to the treatment. And I'll be quoting a patient who said, "I think that what MSF did was perfectly good because when things were hard, this organization did not leave us to struggle alone." In Malawi, patients and healthcare givers were fearful of COVID in overcrowded health centers, and there was a bit of confusion and lack of communication on the daily changes. And there was a reduction of the MSF staff going to the healthcare centers, and they thought that MSF was afraid. That's what the patients thought. And this added to the fear of coronavirus, and because of these people were also living with HIV, and there were rumors and hearsay with information that were not true, fake news that were spread out like this. People said there's a COVID injection. When you get it, you die, and I was scared of the hospital. Normally, I take my medication, but the past few months I wasn't taking them because they're finished, but I didn't come here since I was afraid. But participants have also highlighted their past positive experience with MSF and its services and the efforts that have been implemented to maintain them in spite of the crisis, and the opportunity to share their fears with peers and professionals. They were also aware of the need to carry on with their treatment, with their ARV treatment, and they've also shared their command of the efforts made by MSF to keep them in the healthcare continuum. And this is what a female adult patient said. People said they have an injection that will finish me off, but with the help that MSF gave, I knew no one would harm me. Now let's talk about the perceived quality of care. Participants have expressed the need to have an active follow-up and awareness raising with phone calls or face-to-face interview during the COVID-19, but have also said that they were a bit lost, with their routine, which is a kind of comfortable in their day-to-day life. Another comment from a caregiver. Before the COVID, children had specific days for their peer activities. They would get to know that having this disease did not mean that they would die soon, that they can actually lead a normal and happy life, and they get to meet their peers who have the same challenges as them. Now let's talk about living conditions at home. Even though there was no official lockdown in Malawi, participants have underscored the impact of the pandemic and public health measures on food safety. In Uganda, participants have several times reported the fact that lockdown had an impact on their means of subsistence. SMEs, they were self-employed for some of them. They reported poor health perceived, loss of weight, malnutrition, as well the difficulty to comply and degradation of their psychosocial well-being. And here I'll be quoting an adult patient who said, "Before Corona, we would have likuni porridge, cooking oil, and other porridge. But during Corona, we were no longer given these things. I don't know why. Maybe they've changed the protocol." Conclusion: the COVID-19 protocol has had a major impact on HIV, on Arua and Chiradzulu communities. It's important to mention the resilience of the HIV resilience system with a quick adjustment of the healthcare services and a strong involvement of the healthcare professionals. We still need to promote innovation for people living with HIV, namely with differentiated models, which were a very efficient response model appreciated by patients and healthcare givers during the pandemic, while exploring new types of management. Innovative information campaigns on COVID-19 and healthcare system to reduce and mitigate the fear regarding the disease should be further discussed and explored, and to have an enabling environment to allow for access to healthcare and controlling HIV. We should keep on cooperating with the national authorities and plead for means and solutions that wouldn't be so violent and not so authoritarian in maintaining the restrictions. I'd like to thank Robin, whom you've heard earlier, Pia, Helena. I'd like to thank all those who've participated in the study and the surveyors who've worked in difficult settings, the teams in Arua and Chiradzulu, the coordination teams in Kampala and Lilongwe, the Arua Hospital Management, and my colleagues at OCP Medical Department and the Operational Department. And thank you to all of you for having listened to me. Thank you.